Safe patient transfer and handoff communication are national patient safety goals. Accurate, quality communication prevents clinical errors and increases patient satisfaction with the healthcare. Here at PIH Health, Good Samaritan Hospital, our standard for shift report is at the patient's bedside, including the patient and the patient's family when possible. The evidence shows that the outgoing nurse should prepare both the patient and the patient's environment for a smooth transition approximately 1 hour before the report. The preparation will help decrease interruptions. Preparation should also include explaining what is included in the bedside report, offering to answer any questions from the patient, ensuring that IV fluids are replaced or that piggybacks are flushed, offering repositioning or toileting, and intervening for pain if appropriate. Let's look at an example of a bedside shift report.
Good morning, Mr. Dela Cruz. How are you?
Good morning. I'm good. How are you?
Great. How'd you sleep last night?
It was okay.
Okay. Are you having any pain?
Not right now.
At 7 o'clock, we're going to be having our change of shift, so I wanted to come in and check your IV before we do that. Are you having any pain in your hand?
It's okay.
Okay, and your fluid looks good. During that time, we do talk about some sensitive and personal medical information. Are you okay if you have visitors here during that time?
Yes. Jane is well aware of my medical condition.
Okay, great. Glad to hear that. Nice to meet you, Jane.
Nice to meet you.
Before I leave, is there anything I can get for you? Do you need to go to the bathroom?
Not right now.
Okay, here's your call light. Make sure you use the red button if you need anything, and I'll be back soon. Okay, thank you.
Thank you so much.
Hey, good morning, Robert.
Hey, Alexis.
Hey, you ready for bedside shift report?
Sure.
All right, let's go.
Okay, let's go see our patient.
Hi, Mr. Dela Cruz. How are you doing?
Good morning. I'm good.
Great. This is Robert. He's going to be your nurse today.
I'm gonna put my name up on the board.
He's going to take good care of you. Just letting you know, we're going to go ahead and start with our bedside shift report. We talked about this earlier today. Do you remember?
Yes.
Okay. Feel free to ask any questions as we go along. Are you ready? Mm-hmm. Okay. Mr. Dela Cruz is a 42-year-old male. Came in through the ED with complaints of GI bleed. He had been having black tarry stool for 2 days. Dr. Smith and Dr. Jones are his physicians. Clinically, he's been stable. His vital signs are stable. He's on room air. His stats are good. He hasn't had a fever for the last 12 hours. His abdomen is distended, but it is soft, so he's been okay. In regards to his labs, however, he did have a positive UA and his urine culture grew out E. coli. So the physician went ahead and started him on Rocephin. He's also on Protonics, and he's currently NPO. If he has any signs or symptoms of bleeding, the physician wants you to call him right away. He is a moderate fall risk, and that's because of his lines and his pain medication.
Is the bed alarm on?
The bed alarm is on.
Okay.
Okay, great. The goal for him is to actually get out of bed and ambulate 3 times a day, and he should be up out of bed for all meals. Normally he's independent prior to this admission. He's been independent on his own, but now he requires minimal assistance with the gait belt. Mm-hmm. He also has SCDs on to go ahead and prevent clots. As far as his history, he has a history of hepatitis C, recurrent ascites, and cirrhosis. An EGD was performed yesterday. They found esophageal varices, so the physician went ahead and clipped those. We're gonna go ahead and continue him on the Protonics and the IV hydration. He's on normal saline at 100 mLs an hour, and he also has CBCs done daily. Do you have any questions so far?
You mentioned doing the daily CBCs. Have his results been stable?
They have been. His last H&H was 10.1 and 38.
Okay, great. Do you think there's anything else that I should need to know?
You know, I did forget to mention that he did have a GI bleed in the past, but there was no treatment or intervention, and that was per his request.
Okay, great. All right. Okay, so Mr. Dela Cruz, I'm just going to continue rounding on my patients, and I'll come back to see you after. This is your call light. If you push the red button, it will alert the nursing station, and then I'll come to see you. Okay? Thank you, guys. Oh, Alexis, do you have any other personal or sensitive information regarding the patient I should know about?
You know, he mentioned that he's had a problem with alcohol in the past, and he's under a lot of stress. Okay. So I went ahead and I ordered a social work consult, and I'm hoping he'll be able to cope better.
Okay, cool.
Okay,
Thank you.
Thanks.
Remember that quality communication requires both an active listener and a good speaker, regardless of the shared content. When the report is communicated in an unorganized manner, or the receiver is not listening carefully, the information can be corrupted or lost. Teamwork requires mutual respect, accountability, and transparency. As a team, we can ensure that bedside shift report is streamlined, consistent, and considerate, keeping our patients safe. Remember that you are the patient experience. Thank you.